Welcome back to Tales of Truth, where we tell the truth about veterinary medicine. I'm Dr. Angie, and this is JoJo, veterinary nurse extraordinaire, and my kitty Fiona is joining us today, at least her tail is. And today we are taking questions from the cat people in
From
the
the cat
crowd.
people.
Yeah, so Fiona has decided to show up.
Yeah, we did questions from listeners for dog people,
Yes.
and it's the kitty people's turn. So
Yep.
should we just jump into the questions? Because there's a few of them.
Let's do it.
Okay,
See if I can
the
help.
first one. Our cat Porcini, originally a feral kitten, is now about 10 years old. He has a heart murmur, asthma, hyperesthesia, IBD, and in spite of all of this, he leads a pretty normal and happy life. He's on steroids for his asthma. He takes CBD oil that we get through your online store, and we started that when he was diagnosed with IBD and wasn't eating well. He's also on a single protein wet food.
Mhm.
Let's see. His hyperesthesia seems to be ramping up a bit. The attacks last for a few minutes or less. His back ripples and he runs around and then it's over. He has several during the day, sometimes more. So, question number one, is there anything that can be done for this issue? Our vet suggested maybe gabapentin, but I don't want to go that route at all. And I think a great thing, a lot of people probably don't know what hyperesthesia is. So maybe
Oh, yeah, let's start with that.
let's start with that.
It's basically where when you touch a cat, you know how sometimes they'll like ripple along their back muscles, like their skin. Let's see if I can get Fiona and Shot to do it. Will you do it? No, she's like, oh, I just like to be touched. Um, and they'll have those same kind of, we call them muscle fasciculations, but not necessarily because you've touched them. And sometimes they'll like whip around and look at their back like something has touched them. Like I think Fritz has it a little bit, but only when he gets super feisty. And so it can really haunt cats and it can be problematic. And so this kitty's already on CBD. The first thing I would do is max out the CBD because I've definitely seen CBD help.
Mhm.
The other thing I would do is some body work for this cat, like some chiropractic. And I would not be afraid to try gabapentin. The first thing I thought of was like, oh, we should try some gabapentin because at least you could try it. You don't have to oh, sorry, we have to get her out of trouble. You do not have to keep your kitty on gabapentin just because you try it. And for most kitties, there's not much side effect for gabapentin. I've had one cat in 18 years get diarrhea. So
Mm,
I think it's worth trying.
okay. So
Yeah.
gabapentin. Um, she also has another question. She hates that he's on steroids. She's been told that it's not a big deal.
Mhm.
She said one of the nurses at our vet said her cat has been on steroid for years and it's fine. Porcini basically seems fine also, but I still feel worried.
Yes, I understand. I understand. I think a cat with inflammatory bowel disease and asthma, being on steroids, and I'm assuming this cat's on prednisolone, being on steroids makes so much sense. I always try to get kitties on the lowest dose possible, and if they do well with it, then I don't worry about the long-term effects too much. And when I say I don't worry about them, I don't see them very often. Sometimes cats can become diabetic from steroids, but we usually see that at higher doses or right in the beginning of treatment. And so if we haven't become diabetic by now, we're probably not going to. And steroids help control so much inflammation. And
Mm,
so we can try other things, like we could do inhaled steroids like fluticasone. And we could also do budesonide, which is a steroid that just sticks around in the GI tract. And so we could kind of switch the steroids around a little bit. We can try some herbs. It really just depends on how severe the IBD and the asthma are.
right. Because the oral steroids, would they be using it to combat both? Not
Yes.
combat, but to support both the asthma and the IBD.
Yes.
And the inhaled steroids, would it still support IBD?
No.
Right.
Yeah.
So the oral ones, the budesonide is a better option. And
Yes, and budesonide just doesn't work as well as prednisolone. I'm assuming this kitty's on prednisolone,
uh-huh.
and so it just doesn't work as well.
Uh,
And so it might not be a great option.
and the gains from being on a steroid are just so significant with kitties that have these multi um, faceted disease processes happening.
Oh, totally. Cats with inflammatory bowel disease and asthma, usually they have like some dental disease. Usually there's a lot of inflammation. They do really well on steroids. They tend to feel a lot better. But if we want to, do something different, we can certainly try. I'm not
Okay.
saying it wouldn't work.
Okay. So what I heard is go ahead and try the Gabapentin. Can stop it if it's not a good fit. Max out the CBD dose,
Yep.
which for the average 10-pound kitty, are you talking, when you say max out the dose, are you talking 2 milligrams per kilogram? How much are you talking?
I mean, 2 milligrams per kilogram is a little bit high. I would go like 1 milligram per kilogram. And it's not that 2 milligram per kilogram is a lot. It's just that it's expensive. And I think cats get tired of that skunky taste.
That's
There's
fair.
only so much CBD you can give a cat.
Right. Okay.
Yeah.
Great. Okay. Next one.
Let's do it.
How can I get rid of tapeworms? I had a flea infestation a year ago, got rid of the fleas, but still fight with kitties having tapeworms. I have not found anything to get rid of them without it being harmful chemicals. Totally inside. The cats are totally inside. And the flea population is from the many outdoor critters around my area in town. They are being brought in on our clothes, shoes, etc. I even treat the back wooden steps, very small deck, with salt and food grade. Oh, I can never say this. Dimaticus.
Oh, diatomaceous.
I can never, ever, ever say that word.
Yeah.
Diatomaceous earth. Did I still say it wrong?
That's okay.
Look it up. I'll spell it in the notes. And the rug as well. I've heard that fleas can even jump into windows, which I have a kitty that likes to sleep and look out the back porch window. Have not had an issue so far with fleas this summer, but I think it's because we're having a lot of rain.
Well, if there are tapeworms, there are fleas. And I think so. Praziquantel is what we use for tapeworms, and it's really not toxic. It's not harmful to use regularly, and that's what I like to use.
Okay. And
I don't
that's by
even have
prescription, right?
that is by
Veterinarian have to-
prescription.
Okay.
Yeah, for kitties, I really like Drontal. You have to pill them, but it's so easy. It's just Pyrantel and Praziquantel, which are very safe. They're not toxic.
Mm-hmm.
So I would really do that. You don't have to keep fighting it.
But really, she has to get rid of the fleas.
Yeah, and it sounds like did she say where she lives?
No, I don't think I know what
Okay.
part of the country she lives in, but
It's
it
gotta be
sounds
the
like
South.
fleas are pretty
Yeah. Which
hardy.
is not a problem we have here in Boulder, Colorado, but my guess is that for her where she lives, she's constantly controlling fleas.
Mm-hmm.
And so there's not like, oh, I got rid of fleas. It's just constant control, prevention, and treatment of. And so if she's got fleas coming into her house, then her animals have fleas too. And it's not her fault. But this is why they have like monthly prevention, because you just have to keep
So
on
even
it.
and this is one of those situations with indoor cats, she might want to do a preventative.
Right.
Oh, I'm so glad we don't live in an area like that.
I know.
That
We're
sounds
so
hard.
smug.
Kathy, her name is
I'm so
Kathy. I'm like, that
sorry.
sounds so hard.
Come
it really
move
does.
here. Come hang
Yeah.
out. I have seen in this calendar year, it's August 2025, I have seen a flea on one of my patients.
Crazy. I
Yeah.
want to knock on wood for you. The last thing Dr. Angie said out loud was, JoJo doesn't make mistakes shipping, and I think I made 3 in the next week.
I know. I'm going to see
I was
like 10 fleas.
Don't say it. Okay.
It's too dry.
Yeah.
Anyways.
Next one. 3 months ago, my male cat got scared by a neighbor's dog, and my female cat attacked him. Ever since, they've had to be separated because the female growls and hisses at the male. They were together for 3 years before this with no problems, and there's been little success reintroducing them. What do you think caused this, and what can be done about it? This is from Jeff.
Okay. So I just want to make sure my listening skills were on point.
Yeah.
Okay. So one cat got scared by a dog and attacked the other cat.
No, the other cat attacked the cat that got scared by the dog.
Oh, okay.
So dog came, scared the male, and now the female's mad at the male all the time.
These are so hard.
Yeah. I clarified when I emailed with him. I was like, oh, this is a challenging one.
I know. Where's Jackson Galaxy when you need him? We need to phone a friend. You know what I would do? I would call Michelle at the cat behavior clinic. Because I don't know that I'm going to have a really good answer. Because what veterinarians have to provide, I can provide stress relief with supplements and pharmaceuticals, but a behavior expert might be able to say, this is what you should do. You should separate them. You should, because how long has it been?
Oh,
Months?
months, 3 months, I think he said.
Yeah, I don't
Yeah,
know. I think call Michelle.
yeah.
She's
I
amazing.
agree with you. This is also where I want one of those cat communicators. What happened? What happened that this female kitty is just like, "Oh, yeah, now we're enemies."
What cat
Like,
communicators?
I don't know of one.
Oh, you mean like an animal
Yeah,
communicator? Oh,
yeah, an
yeah.
animal communicator. Yeah,
Yeah.
how were they going? Because I really wanna know the story. What happened?
I know. Like well, when Fritz broke his foot, and
Yeah.
he went away, got sedated, and then came back, Fiona was mean to him for
Yeah.
2 weeks.
They do that when they come back smelling different, so that's right, when they've gone to a hospital
Yeah.
and come back, I've always thought it was about smell,
Yeah.
and then eventually, they transition into being friendly again. But this has been a long time. He said he absolutely can't do any reintroductions. So
That's
it's like, did
terrible.
that cat release something out of fear? Some kind of
Well, and who's holding a grudge that doesn't need to be holding a grudge?
yeah, I don't know.
That's what we need to
Yeah, I know. Okay, cat behaviors, and I think that's something that happens a lot, is I think in this industry, at least I know I get asked a lot about behaviors,
Yeah.
and I don't actually know a lot about
No.
behaviors. And a lot of
And
veterinarians don't either. It's more medical.
I mean, we know some, but not like that very specific piece.
Uh-huh.
No, like we know some basics, but
Yeah.
Like Michelle, she's just my favorite. I love her so much.
Okay.
So,
We'll send
yeah,
him we'll send him Michelle's way.
she'll do way better than me.
Okay. Next up. I have a cat, 14 years old, with a small cyst on her chin. It has clear fluid in it. It grew slowly until after 4 months it burst. It was
Uh-huh.
gone for a month and now it has started again. It doesn't seem to bother her. Maybe a little itchy because I think because she rubs her face, but she could just
Mhm.
be marking. My holistic vet says it reoccurs if one cell remains and has no idea what to do. She does Chinese and Western medicine, acupuncture, laser, no homeopathic. That was her question about the
Oh,
cyst.
there's nothing to do.
Just let
I'm
it
going to
come and
liberate
go.
you from needing to do anything. If
Okay.
it's bothering your kitty, we could surgically remove it. But what your veterinarian was saying was that as long as those cells that are lining the cyst, as long as it's there, it's going to keep creating a cyst.
Mhm.
And so until we take that out, it's going to keep doing it. But we have to think about, okay, taking that out is a surgical event. I don't know how big it is. I don't know how much skin there is to close it. And so if it's not bothering your kitty, then it's just, I would leave it alone.
Let it be.
Let it be. I
Okay.
release you.
Nice. That's like the best answer.
Yeah.
Okay. Noreen also has another kitty. It's a seal point Siamese who has a plugged acne at the corner of her mouth. So probably that black.
Mm-hmm.
Yeah, I know. I just said that because I get excited about scraping it.
Yeah, like you
Yeah.
want to just squeeze it.
Yeah, yeah, yeah. So I got a little excited. I got ahead of myself. She's the daughter of the cat with a cyst. The acne is a black dot like a beauty mark. Um, no advice on this from my vet either. She seems not bothered by it. Food and water dishes are stainless steel. Any ideas?
I think I would leave it. I would
Yeah.
leave it. I mean, if you wanted to do something, you could start putting chlorhexidine on it. But I,
Uh-huh.
I honestly wouldn't. If it's not bothering her and it's just cosmetic, just leave it.
Okay.
Yeah.
Wow, those are easy answers for
I
Noreen. Like,
know.
let
Like,
them
do nothing.
be. Yeah, all is
Do
well.
nothing. All is well.
Okay. Next up. This is a kitty that you've seen before.
Okay.
So this is from Sarah. Her topic of interest is over-grooming,
Oh,
also known
yeah.
as barbering. Her sweet and quirky Siamese Luna has been over-grooming for 2 years. We went through expensive cat dermatology and did a novel protein food trial to see if it was caused by a food allergy, and it wasn't. According to the dermatologist, most cats are over-grooming because of a physical allergy, not because of some kind of mental illness. Their next recommendation was years of expensive immunotherapy, wherein I administer a shot every week. No, thank you. I don't want Luna to suffer. I don't know what to do. A man I know who has 11 cats said he has one who used to overgroom, but now that cat is on feline Prozac and they haven't had any issues since. Is overgrooming physical or mental or both? It's a good one.
Yes. And this is a good one. I had a cat that overgroomed, and it was definitely not. It was when I had a baby.
Mm-hmm. Stressful.
Yeah. He eventually stopped doing it. But I think that in this case, because I know this kitty, I think there's a chance it could not be. There was a big move involved, and I think the mental health aspect is important. I saw on TikTok a veterinary dermatologist that I love. I follow her, and now I can't think of her name, but maybe we'll put her in the show notes. She was saying that 80% of over-grooming is a medical problem and
Huh.
not a mental health problem. Okay, so that's true, but, like, then we still have, like, 20% of cats that maybe do respond to Prozac. So I think we could definitely try something like that
Uh-huh.
because, most of the time it's not. And I feel like there are some of her lesions, like her over grooming where it looked itchy. So a lot of cats will just pull their hair out. And
Uh-huh.
then some cats actually they're not hot spots like dogs get, but they're kind of scabbier, which
Huh.
makes you think more of an allergy, but not necessarily. And so I think trying Prozac would be totally fine.
Yeah. Okay.
Call me.
Yeah, definitely. Or email.
Yeah.
Yeah, on those I can remember a cat that we saw that was really over-grooming its belly, and I learned a lot in that when I started nursing with you, because cats can overgroom in certain areas if they have indigestion or, they might be
Yeah.
licking because 'cause they're uncomfortable, or a joint, they might be over-grooming because they're painful.
Yes.
So that's one thing. So there's a lot of so it sounds like it could be an allergic reaction. It could be a mental aspect. It could be pain.
Yes.
I mean, this kitty, I know you know more about it, but other kitties that are over grooming, there's a lot of rule outs.
A lot of rule outs, and sometimes you never figure it out. And
Uh-huh.
sometimes cats are thin, they just, like, have bald limbs or bellies.
And I think it's adorable, which is not the point. But I do think they're so cute with their bare bellies. Yeah. I know that's not the point. Still get them seen, don't go for cute. Okay, next one. I have a senior 17-year-old female cat who is indoor outdoor. She's mainly indoor, but thinks she's a dog and likes to do her business outside, especially her poops. How can I stop her from getting us up at 4 to 4:30 in the morning to go out every day? She's on methimazole and has slowed down immensely, so I'm just wanting her to live her best life. And I love the way this person signed their email. Did I create a monster? Thank you, Kim, by letting her go out to go to the bathroom.
Yeah, Kim, you did. You did. I think, first of all, I love you, Kim. I think that it's really hard once cats have started to go outside, and they do prefer going to the bathroom outside.
Uh-huh.
It's really hard to say, "No, you're not gonna do that."
Yeah.
Now, her waking you up at 4 AM,
Ooh-cha.
that's a whole 'nother thing and is not can you lock her out of your room? I just want you to get sleep. That's where I'm gonna become your advocate, Kim, is that she can't wake you up at 4 AM.
No, it's not sustainable.
That's not sustainable, so we have to have a conversation about
Right.
that.
Where's the compromise? What would the compromise look like here?
I mean,
I know that that means the cat has to compromise.
the cat has to compromise. Well, the cat needs to not have access to wake up her parents
Uh,
at 4 AM.
uh-huh.
I I really feel strongly about that.
I was
I
wondering, could she adjust her meal time so maybe she didn't have to poop at 4 AM?
But do you think she really has to poop at 4 AM, or
No.
she's probably just up and, like,
Like,
it's when she's active?
well, I mean, there are those fortunate ones that are just so consistently, I have to poop at this time.
Yeah, that's true.
So if she's really pooping, could we move her schedule?
You could. I mean, I think it's a viable option.
I'm just trying to think because I don't know. If she shuts her door, that cat might just sit outside her door and meow.
Well, then she's gonna have to go in she's gonna have to have another barrier
Yeah.
between I don't know. I know a lot of cat parents think I'm mean for that, but I sometimes my cats are getting old enough that sometimes I let them sleep with me, but sometimes I don't because they're jerks to me in the middle of the night.
Uh,
Like, they wake me up and they meow at me and I just can't do it. I
well,
gotta
yeah.
sleep.
Then we become jerks.
Then we become jerks.
Yeah.
And so I don't know that we can stop this kitty from going outside, but I think we
Yeah.
can stop this kitty from waking you up.
I wonder also if there would be a way. I'm just creatively thinking. Can this kitty have access to the outdoors? Like a catio?
I mean, catios are the answer to everything.
Right.
The
So
only
they
thing
can
so
go
you'd
in and
have, like,
out at their leisure.
a catio a cat door to a catio.
Yep.
It's a little construction,
Yep.
but it might solve the problem.
Dude, I would do anything for sleep.
I know, right?
Yeah. So, oh,
Yeah.
that was our answer for that.
Yep.
Yeah. Sorry. Sorry you have a monster.
I know, we love your little monster,
Oh,
though.
yeah. I know. We all have them. Those are all of our questions from
Yay!
listeners for now. So,
Okay. Well, if
yeah.
you have questions for us, leave them in the comments wherever you're watching this, right after you leave us a review.
Yes, please.
Please leave us a review, leave us a comment, and we will, like, if you have a question, you can leave it. You can leave it in Instagram, Facebook,
We're
wherever.
back on TikTok.
We're back on TikTok. Sorry
Which
for all the people we did not answer, like, all the questions. I
I
just thought they were
didn't
going to ban
know.
it again, so I just got off of it.
Oh,
But that was
yeah,
years ago.
it
I don't
is.
know.
So I opened TikTok and I'm like, oh, we have stuff from 2021. So can we just have a reset?
Yeah, I
We
think we can.
created a monster on TikTok
I know. I know.
and
We're
and
really
we're
sorry.
ready to slay it.
Yeah. Like the kids say.
Yeah.
Um,
I don't know if they do.
they do. They
Oh,
do.
they do. Okay.
Yeah.
Well, go
Okay.
slay your day.
Go slay your day but leave us a review first and send us your question. And if you want to know more about anything on our website, anything we talk about, whether it's cats or dogs, you can grab one of our courses for free using the code Tales of Truth, right?
Uh,
No.
Truth Tales.
I
That's
do it
okay.
wrong.
That's okay.
Tales.
Truth Tales is the code for your free course.
And you can spell tails however you want to.
Yep, both ways work.
Yeah. Okay. But go get
Okay.
it. It's
Yeah.
free. Those are
Yeah, I mean, just on
$97.
things we covered today. There's a holistic approach to fleas and ticks.
Yeah. Go get that.
Yeah.
Okay. We'll
Okay.
see you next
Bye-bye.
time. Bye.